Susan Angel with CNS Healthcare joins us, and today we're speaking about binge eating. Who might get it? How does it develop? And what can be done about it? Welcome, Susan.
Thanks for having me.
Sounds great. Tell us about binge eating. It is a disorder, and it may be more common than people at home think.
Yeah, actually, binge eating disorder is the most common eating disorder in the United States. Even though it's a small percentage, only maybe 2 or 3%, it is a significant number, and it typically affects women, more than it does men.
Mm-hmm. What are the causes of binge eating disorder?
When you think about binge eating disorder, there's not one real specific thing that they have identified as the cause, but there are a number of things: biological, psychological, environmental causes that bring on these types of eating behaviors. And there is some research that supports that some of these may be even inherited. There's a strong correlation with people who have depression, also have symptoms of binge eating disorder. Mm-hmm. And so there's a real emotional tie to the eating. So people who have a lot of negative emotions may seek to eat in those types of episodes in a way to manage their uncomfortable feelings.
Okay, so would binge eating then be sitting down and eating a lot of things at one sitting, or would it be like something that happens to someone over the period of a week, maybe where they gorge themselves at each sitting? I don't know for sure how it works.
Yeah, it's a diagnosis, and there's a specific criteria that has to be met. So there are recurrent binge episodes, and what constitutes a binge episode for this type of disorder is the fact of eating unusually large amounts of food in a short period of time. So when we're collecting information from patients about their eating behaviors, say we might give them a week's calendar and ask them to document their food intake. And what you'll find is that patients will eat unusually large amounts of food, and maybe in a period of 2 hours or less. And they eat until the point of being uncomfortably full. But what's different than overeating is the fact that they have all these negative emotions associated with it. So not only are they eating large quantities, they feel like they have a lack of control over what they're eating. They have guilt feelings associated with what they're eating. They may also hide their eating behaviors. So like, for instance, a lady would tell me, Susan, I feel so bad. I'm on the way home, but I stop, say at a fast food restaurant. I'll have a meal all the way in the car, on the way home, and then I'll prepare the meal, for the family, then eat again in a short period of time, or either, oftentimes it may be after the kids have gone to sleep, hiding, and because they feel so guilty about what they're doing. And so while you have the overeating, it's not just overeating, it's all these negative feelings in a relatively short period of time that occurs on a regular basis.
Okay.
And just feeling lack of control.
Yeah. So when we've all overeaten before and we feel like, gosh, I'm really stuffed, and it comes to my mind, like, maybe like around the holidays or whatever, and you're going over to somebody's house. So there might be that sense. This is a feeling like that often?
It happens frequently. And so for people who are meeting criteria for this diagnosis, who are coming in to enroll in a clinical trial, they are having 2 to 3 binge episodes per week, and it's been going on for an extended period of time. So, even beyond overeating, because guilty. Obviously, there's lots of us that overeat, during the course of the week. But again, it's, we might have been like, dadgummit, we shouldn't have eaten all that. Sure. But these feelings that the people have that have this, it causes significant distress for them.
Okay, yeah. And are these people generally overweight then, or not?
Well, 2/3 of the patients, I would say, are overweight. And then there are others that you may not know that, but in most instances, they would be overweight.
Unless their binges are spaced apart where they're not. Okay, now let's talk about what you guys can do at CNS Healthcare and the trials that you have going on right now. Specifically, if you or someone has this, what can we do about it?
Well, binge eating is kind of a new phenomenon in terms of diagnosis that people are more comfortable talking about in the last few years. And so they've been evaluating medications that could help people control these episodes. And so we are evaluating the effectiveness of a new oral medication. It is a non-stimulant, non-controlled drug that would reduce the frequency of binge episodes, and subsequently we anticipate there may be weight loss associated with it. So not only would you be getting control over the impulsive episodes themselves, but as a result, I may see some weight loss as well.
Okay,
So,
and they said this is not a stimulant type of drug, so it wouldn't make somebody feel hyper? Or...
Yeah, like right now, I think Vyvanse is the only approved medication on the market right now for binge eating disorder, and of course it has uses for ADHD and along those same lines, which you take on a daily basis. So, and of course, it's a controlled substance, so you would need special permission to continue that for an extended period of time. But like with our evaluation, because there are so many health risks associated with binge eating,
sure.
Like heart disease, elevated blood pressure, diabetes,
wow.
gallbladder issues, it's really important to get a handle on it. So when they come to see us, they'll get a full evaluation, lab work, ECG, vital signs, so a complete health workup, medical workup, and of course it's at no cost to them. And then we would also evaluate the effectiveness of any new medications.
Okay, so the number to dial is right there on your screen, 904-281-5757. CNS Healthcare is centrally located right off of Belfort Road, near St. V's, right there.
Correct.
So it's easy for anybody to get to, whether you're coming from downtown, Mandarin, or the beach. Give them a call. Susan Angel is in charge out there. Thank you so much.
Thank you.
Good information to pass along.
Thanks, Karen.
You bet. Thank you. Coming up tomorrow from 9 to 3 at the Prime Osborne Convention Center, you'll want to grab a friend and head to the Senior Expo. All types of vendors will be on hand to answer any questions that you may have, from your health to things that you can buy to transition to senior life. Again, things get started at 9 a.m. tomorrow morning. Coming up next, 904thin.com, helping you lose weight and get healthy at the same time.